Good morning, everybody. Dr. Art D'Antonio here with my two colleagues, Candace and Becky. And what we're going to do today is show you how you can set up to be pliable in your squat and your hip hinge. So we're going to start with our hip flexor stretch. And Becky is going to get Candace into position. And we're going to look at the particulars. Beck, what about that front foot? Is that in good position there?
That looks like it's good position. It's right underneath her knee, so she can really press right into the ground, stay upright.
Okay, let's talk a little bit about what the pelvic shelf is going to do. We're going to move that pelvic shelf back and forth. Give us a little illustration, and Beck,
So
go
Candace,
ahead.
keep your torso nice and upright, and from here, you're going to move your hips forward whilst keeping your torso as vertical as possible.
Okay, this makes a world of difference on that trailing leg, everybody, because the ASIS, the anterior superior iliac spine for you functional anatomy nuts, is now stretching there. And in the rear part, the PSIS, the posterior superior iliac spine, is in contraction. We got a very good setup there, and we've got a nice way to move that entire complex of the hip flexor back and forth. Candace, why don't you get up for a minute and back? Let's turn her around, okay? And face the other way.
We're going to face the other way with the same leg.
Okay, now set yourself back up. We're going to get a picture again now from the other side. So we've got sort of a duality of what's happening here. Now again, as Becky set her up in that stretch, you can see what's going on in respect to that too. We're getting some lengthening in the hamstring, activating the glute, and we're keeping the weight, as Becky said, in that front heel. We're getting a good look at what's going on in that. Now that's a complex. Remember that. Okay, Candace, come on up. That complex involves quite a bit of musculature. We're talking about everything from the TFL to the rectus femoris, down into the adductors, and all that grouping. So what we have to do here is we have to get a sense of compliance. Beck, what I want you to do is put Candace on the floor in a Superman position.
Okay.
Okay?
Let's have you lay face down.
Okay. In this position, I want you to lift up your feet and your hands. Right there, we're allowing us to get movement and contract the glutes. And we're realigning the vertebral body in the back. Come on down, Candace. This is a very simple, very aesthetically pleasing move that allows us to realign the spine and set up so that we can move the pelvic shelf just a little more. Okay, Beck, I want you to go over to Candace, and I want you to do is, I want you to come out in a T fashion, one half, and open up her thoracic area in her back. So we're going to just open up, but give her a little PNF, a little proprioceptive movement, a little help.
Is she going to be face down or kneeling?
Let's stay that way, but face the mirror.
Okay.
Okay? That way you can get a good look at what's going to happen with her back. Okay, put your hand out to the side, Candace, please. All right? Now, Beck, I want you to go over there and augment a little movement. So, and hold that movement for her. Bring her back. And then we're going to hold 1, 2, 3, 4, 5, and then release. Now, when you release, you get a certain amount of viscosity and lubricancy in that pec minor in the front. Up again. Let's do it again, please, Candace. And back, pull back. And this is how you can augment someone with something called PNF, proprioceptive neuromuscular facilitation. But what it is sort of an assisted stretching movement. Very nice. And go back and down. Take your hand straight up, Candace, with your palm neutral. Now back, bring her back this way. Posterior for me, please. Yep. Now when you get back that way, I want you to gently push against Beck's hand, Candace. This is a partner assisted type thing. Activating the pec minor. Okay, let's release it. Good. Now, you'll come down, and then I want you to put your hand back up again, and we're going to release back again. And these are simple. 1, 2, 3, 4, 5, and release. Good. Now, what we're doing here is we're taking live tissue and we're adding a certain amount of viscosity, we're increasing the movement pattern, and we're allowing for the muscle to understand, because everything is controlled by your brain. All right, so what I want you to do a little bit here, Beck, is we're going to set her in a push-up position, okay? And I want you to sort of talk about what happens between her pec major and her T-spine.
Okay.
Okay, so let's set up.
Let's have you face this way. You're gonna get your hands slightly wider than shoulder width, right around there. And from here, you're gonna get length in your pecs. These, your shoulder blades are gonna come down and together. You're gonna slowly lower to the floor. And right here, you're gonna get a nice stretch in your pec, activating your back. You're gonna push right through.
Excellent, excellent. So let's see it again, please, Candace. There it is. Retraction, and up, and hold. Okay, you can go to your knees right now. Very nice. The pertinence of that and what Becky's talking about there is that retraction of the scapula. Filling in the rhomboids, activating all that middle trap area, and then deep into that fiber around the spine. A lot of times we cut this short by doing a shortened range of motion, and we don't get that ability to get a horizontal push-pull, which we need. Let's do it one more time so we can see. And Beck, again, an explanation of what goes on.
We are going to actually squeeze your back throughout the rep. And from here, you're going to feel your chest activating. You're going to feel your back active. And as your back and your shoulder blades come together, you're going to get much more length in your pec. And you should feel your pecs under that tension.
Excellent. Come on up. And as Candace goes to her knees, that's an excellent thought. If you come up and then drive yourself up and you should injure your back in some form, it's much smarter to put your knees back under you and release that pressure on your lower back before you come up. Okay, I'm going to ask Candace to stand up now and face us. And what I want you to do, Beck, is just give me an illustration. I want you to show on Candace where those adductors on the inside of the leg are. Okay?
Alright, her adductors are running right through here.
Okay, now the abductors.
On the outside, so these would be what brings her leg outward.
Very good. So this marriage that we want between these two parts of the leg make a big difference at what goes on in the hip and your ability to control the hip. All right, have her flip around again, to the side, please, Candace. And show me that where that glute medius and that runs into that lateral aspect again.
Alright, so her glute medius is going to be the side of her glute coming down.
Very nice. And that will tie into your TFL, and that will run down your leg. Now, the glute medius is probably one of the most unexplored areas in the body because of the nature of us not moving much in the transverse plane and working side to side. I want her to go down on both knees, if she could, please. And then Beck, I want to see a kneeling squat.
Okay.
So let's go into a kneeling squat, all right?
Alright, so from here, Candace, you can actually angle your feet. If this is more comfortable in your hips, yep, you can angle them together, just like a squat, how you'd have a slight turnout. And from here, hips come through and forward.
Very good.
And you're going to sit back into those heels, get a lengthening in your quads, and then hips lead.
Okay, we're getting wonderful length in there too, and we're not getting any shifts in her lumbopelvic area, and she has control. A great way to deem where you are in the equation right now. Come on up, Candace. All right, we're going to be doing a lot more in all of these different areas, and we want to keep giving you a peek of where we're going, because eventually we're going to work this into a regimen showing you how you can fill in your programming. And Candace and Beck can give you an idea of what correctively exercise programming is and how it will enhance your immune system and increase your overall mobility and flexibility. I want to thank the both of them today, and I want to thank my good friend John Mears, who is